All right, welcome to the deep dive. Today, we're going deep, really deep into something, it's super important in healthcare. Getting those medication dosages absolutely spot on.
Oh, yeah.
Think about it. I mean, from that basic, over-the-counter pill to like those seriously complex 4V infusions. That precision, how we calculate and how we administer medication, it directly impacts how our patients are doing.
Yeah, yeah.
So this deep dive, I mean, it's, built for all of you, whether you're already a nurse or you're on the path to becoming one.
Right.
We're going to break down, all those systems used for measuring medications and like the big one, how to actually perform those dosage calculations like a pro with accuracy and, keeping our patients safe.
Absolutely.
That's the goal.
Yeah. Our core mission today is really to, give you that solid, practical understanding of these calculations, always keeping that patient safety top of mind.
Always. Okay, let's rewind a little bit and, look back at how things have been done. It's kind of interesting to see the different ways people have measured meds over time. Right?
Yeah.
We have the metric system, which is like the gold standard these days. But then there's those, older systems like the apothecary system, even the household system, people using teaspoons and stuff. And then there's that, less common avoirdupois system.
Yeah, and what's really interesting is when we look at all these like different systems is you kind of see this history, right, of pharmacy and how medicine has evolved over time.
Yeah.
Like the metric system, it's really elegant, right, with that base 10 structure. And, you have grams for solids, liters for liquids, makes conversions super logical within the system. Then you have like the apothecary system. This is way older.
Oh, yeah?
This was used by the apothecaries. They were like the OG pharmacists.
Right.
And they used, grains for solids and minims for liquids.
Huh.
And you'll see these Roman numerals, which is super interesting. And it really shows you like this different era of medicine. Now, you might not use it every day, but just knowing like the historical context, it's still really relevant.
Yeah. It's like you never know. You might run into it, like in some old patient's chart or even just talking to somebody.
Exactly.
Then there's the household system. This is the one everyone's, kind of familiar with.
Yeah.
Pounds and pints and teaspoons. It's what people are using in their kitchens.
Right.
But, and this is a big but, that familiarity can actually lead to mistakes because a teaspoon at home, that could be totally different from like the official teaspoon we use in medicine.
Absolutely.
And that's, a big deal when we're teaching patients how to take meds safely at home.
It is.
When they're not in the hospital or the clinic. And I guess lastly, there's that, avoirdupois system. What is that all about?
Yeah. So that one's mainly used for like bulk ingredients, and you don't see it too much in, modern prescriptions.
Mm-hmm.
Right.
Yeah. Now, the big change, the move to make things like standard, to really make things clear, it happened back in 1995.
Yeah.
When the U.S. Pharmacopoeia Convention, they said, listen, we need to use the metric system on every prescription.
Makes sense.
And for dispensing all medications.
Yeah.
This was a game changer. It really helped to reduce all that confusion and the chance of making, a mistake with the doses.
Right.
Now, all meds are given using that metric system, but, and this is important, we still got to know how to convert between these systems.
I see that.
Right. You might get an old order, or a patient might say, oh, I take 2 teaspoons, whatever. So knowing how to convert, basically finding those equal values between the different systems, that's still a must-have skill.
It's like a safety net.
Exactly.
Okay, so we have this history, different ways to measure, and, everyone's moving towards using the metric system. But let's talk about why getting these dosage calculations right, like precisely right.
It's so crucial. It's not just about crunching numbers.
It's not just about the math.
Right.
Absolutely. Getting the dose right, that's a team effort.
Yeah.
It involves everybody, the prescriber who, figures out that initial dose, the pharmacist who gets it ready and gives it out, and then the nurses. You guys are the last step.
Big responsibility.
You're making sure that medication is given correctly. And there are tons of situations where the dose the doctor orders, it doesn't perfectly match what you have on hand.
Okay.
Like let's say a doctor orders a large dose. You might need to give multiple pills or tablets to reach that dose. And that means calculations.
I can see that.
Right?
Now, we have some cool new things to help us.
Yes.
We've got like unit dose packaging, electronic medical records.
EMRs.
Yeah, EMRs. That's helped to reduce, doing calculations by hand.
Definitely.
And it's made giving meds safer. But we can't just rely on those.
Right. We can't get complacent. Technology, it's awesome. It helps so much. But it's not a replacement for actually knowing your stuff.
Yeah.
For your clinical knowledge and for thinking critically.
Makes sense.
Healthcare pros, they've got to be able to do the calculations and, this is even more important, double check them.
Right.
Think of it like a backup safety system.
Okay.
If the tech messes up or if somebody enters the wrong info, understanding the math behind it all, that can be what saves the day.
Literally saves the day.
Yeah, literally. And remember, legally and professionally, nurses, you're responsible for every medication you give a dosage error, even if it's a total accident.
Yeah.
It can have really bad, even life-threatening results for the patient.
Absolutely. Absolutely.
Yeah.
Okay, so we need to understand why we're using these numbers. Yeah. Not just blindly plugging them in. So let's talk about the how. Our sources talk about 3 ways to calculate dosages, ratio and proportion.
Yep.
The formula method, this is the desired over half.
Desired over half, that's the one.
And then dimensional analysis. So let's break them down one by one, starting with, ratio and proportion.
Ratio and proportion. So basically, you're setting up a math problem that makes 2 ratios equal.
Well,
one ratio is like the known relationship between, how strong the medication is in its form, like milligrams per tablet.
Got it.
The other ratio includes the dose you want to give and the missing piece.
The X.
Yeah, the X, the thing you got to figure out.
Right.
For pills and capsules, it usually looks like this. The amount of drug you have is to 1 tablet or capsule, as the amount of drug you want to give is to the number of tablets or capsules you need to give. Let's take aspirin.
Okay.
A patient needs 324 milligrams of aspirin,
okay,
but all you have are 81 milligram tablets.
Yeah.
You set up like this. 81 milligrams over 1 tablet equals 324 milligrams over X tablets.
Okay.
You cross multiply. So 81 times X equals 324 times 1, and that gives you got to give 4 tablets.
Okay, so we're establishing that direct equivalence.
Exactly.
All right, makes sense. Now let's move on to desired over half. This one seems pretty straightforward.
It is. Desired over half. This is like the go-to method.
Yeah.
Super easy to remember. It's written like this. Desired dose over available dose times the quantity you have equals the amount to give. Let's try something a little trickier.
Right. Yeah.
Let's say a patient needs 0.05 grams of spironolactone.
Okay.
But it only comes in 25 milligram tablets.
Okay.
Now, the first thing, and this is where people can trip up, is you got to make sure the units match.
Got it.
You got grams in the order and milligrams in the tablets.
Right.
You got to convert. 1 gram is 1,000 milligrams.
Yes.
So 0.05 grams, that's 50 milligrams.
Okay.
Now, plug those numbers into the formula. 50 milligrams, that's your desired. Over 25 milligrams, what you have, times 1 tablet equals 2 tablets.
Right. So that unit conversion, that has to happen first.
Absolutely. That's key.
Okay. Got it. And last but not least, dimensional analysis. This one, it looks a little more complicated at first.
It can with all the fractions and units, but it's super helpful for keeping track of everything and making sure your final answer has the right units.
Right.
Dimensional analysis, or the factor label method, focuses on the units. You set up an equation where you start with the unit you want, and on the other side, you create a bunch of conversion factors.
Okay.
These are ratios, and they're arranged, so all the units you don't want, they cancel out,
Right. See.
leaving you with just the unit you need. Let's go back to that spironolactone example.
I see.
We want to find the number of tablets, right?
Right.
So you start with X tablets equals 1 tablet over 25 milligrams times 1,000 milligrams over 1 gram times 0.05 grams over 1.
Okay, I see how the units are canceling.
The milligrams and the grams, they disappear, leaving you with just tablets.
That's cool.
You do the math and you get, again, 2 tablets.
Okay.
Now, the really great thing about dimensional analysis, it's like a built-in check for your units.
Oh, that's really helpful.
If the units aren't canceling out correctly, you know something's wrong with your equation.
That's a great tip.
Ugh.
So these 3 methods, they all seem to work well for solid meds like pills and capsules. But what about when you need to give like half a tablet or a quarter of a tablet?
Yeah, fractions.
Or what if the med comes in liquid form?
So when you're dealing with those fractions, like half or a quarter of a tablet,
right,
you got to be careful. Some tablets have a score, that little line down the middle. That means you can split them.
Okay.
Pill cutters can be handy.
Yeah.
But huge. But not all tablets are safe to cut.
Oh, okay.
Things like delayed release, controlled release, sustained release meds.
Yeah.
Those are made to release the drugs slowly in the body.
Right.
If you cut or crush them, you mess that up.
That's not good.
Yeah, you could end up releasing the whole dose at once, or the drug might not even work.
Oh, wow.
Capsules, too, usually you shouldn't open or split them.
Okay.
When in doubt, and this is so important, check a drug reference.
Yeah.
Or even better, talk to the pharmacist.
Yeah.
If you can't get the exact dose with the pills or capsules you have, you got to look at other options.
Different forms or strengths, or, talk to the doctor.
Exactly.
Okay, that's a good reminder.
Safety first.
Always. So what about liquids? Those same calculation methods, do they still work?
They do. The basics are the same, but instead of finding the number of pills, you're figuring out how much liquid to give, usually in milliliters.
Okay.
Let's say a patient needs 250 milligrams of amoxicillin,
Okay.
and you have this liquid suspension that says 125 milligrams per 5 milliliters.
All right.
Ratio and proportion, you set it up like this. 125 milligrams over 5 milliliters equals 250 milligrams over X milliliters.
So,
Cross multiply, solve for X, and you get 10 milliliters.
got it.
Now, desired over have, it looks like this. 250 milligrams, that's what you want. Over 125 milligrams, what you have, times 5 milliliters equals, you get 10 milliliters again.
Okay.
Dimensional analysis, you'd have X milliliters equals 5 milliliters over 125 milligrams times 250 milligrams over 1. Milligrams cancel out. You're left with 10 milliliters.
So same math, different units.
Exactly.
Okay, that makes sense. What about injections? They seem a little more complicated because you have concentrations per milliliter.
Yeah. Injection. So now you're figuring out how much liquid you need to inject to give the right dose.
Right.
And those same three methods, they work here too. Let's say someone needs 7.5 milligrams of midazolam intramuscularly.
Okay.
And the vial says 5 milligrams per milliliter.
Got it.
Ratio and proportion, you set it up. 5 milligrams over 1 milliliter equals 7.5 milligrams over X milliliters.
So
Solve for X, you get 1.5 milliliter.
makes sense.
Desired over have is 7.5 milligrams, what you want, over 5 milligrams, what you have, times 1 milliliter,
Okay.
equals 1.5 milliliters.
Right.
And dimensional analysis, X milliliters equals 1 milliliter over 5 milligrams times 7.5 milligrams over 1 equals, again, 1.5 milliliters.
Okay, so you just got to know the concentration.
Yep. How many milligrams or units are in each milliliter and the total dose you need to give?
Got it. Let's move on to IV solutions and infusions. So we have these fancy electronic infusion pumps.
Yeah.
But understanding the math behind them, the calculations,
Still important.
it's still important, right? Why is that?
So electronic pumps, they're fantastic. They're super precise.
Yeah.
But you still got to program them correctly. And that means doing some calculations, like
Yeah.
how many milliliters per hour do you need to give a certain volume over a certain time?
Right.
And sometimes pumps aren't available, or they malfunction, or you're doing a certain type of infusion and you got to go old school.
Manual drip rates, right?
Exactly. And you got to remember, microdrip systems, they give 60 drops per milliliter.
Okay.
Macrodrip systems, they can be different, like 10, 15, 20 drops per milliliter.
Right.
Always check the IV tubing package to see what the drop factor is.
Yeah, that's a good point. So with the electronic pumps, we're usually calculating milliliters per hour.
Yep.
Can you walk us through an example?
Sure. Say a doctor orders 1 gram of cefotaxime. It's mixed in 100 milliliters of normal saline,
Okay.
and it needs to be infused over 45 minutes.
Got it.
You got to figure out the rate in milliliters per hour to program the pump.
Right.
Ratio and proportion, it looks like this. 100 milliliters over 45 minutes equals X milliliters over 60 minutes.
I see.
Because there are 60 minutes in an hour, right?
Right.
You solve for X, you get about 133.33 milliliters per hour.
Okay.
Usually you round that to the nearest whole number.
So 133.
Yep, 133 milliliters per hour.
Okay.
Now, desired over have, you want 100 milliliters in 45 minutes, but you want to know how much that is in 60 minutes.
Right.
So 60 minutes over 45 minutes times 100 milliliters,
Okay.
again, about 133 milliliters per hour.
And dimensional analysis.
You'd have X milliliters per hour equals 100 milliliters over 45 minutes times 60 minutes over 1 hour.
Same answer.
Same answer, about 133 milliliters per hour.
Okay, so the math is consistent. We're just calculating a rate over time.
Exactly.
Now, what about those manual infusions where you got to count drops?
So for those, you got to calculate the drip rate in drops per minute.
Okay.
Let's say you have an order for 400 milliliters of D5W.
Okay.
It needs to infuse over 4 hours.
Got it.
And you're using a microdrip set.
60 drops per milliliter.
Right, 60 drops per milliliter. The formula is total volume in milliliters times drop factor, all divided by total time in minutes.
Okay.
So 400 milliliters times 60 drops per milliliter divided by 4 hours, that's 240 minutes, right?
Right.
So you have 24,000 drops divided by 240 minutes equals 100 drops per minute.
Okay.
You can also use ratio and proportion. 60 drops equals 1 milliliter. To give 400 milliliters, you need 400 times 60,
Which is true.
24,000 drops.
Right.
Over 4 hours, that's 240 minutes.
Uh-huh.
You divide total drops by total minutes.
Okay.
24,000 drops divided by 240 minutes. That's 100 drops per minute.
Okay.
Now, let's say you're using a macro drip set. Maybe it's 15 drops per milliliter.
Okay.
Same 400 milliliters over 4 hours. The calculation is 400 milliliters times 15 drops per milliliter divided by 240 minutes. Okay. That's 6,000 drops divided by 240 minutes, which is only 25 drops per minute.
Wow, that's a big difference.
Huge difference depending on the drop factor.
Really important to know what kind of tubing you're using.
Absolutely.
What if you have an IV medication that needs to be given over a shorter time, like, less than an hour?
Same idea. Let's say you got to give 50 milliliters of an antibiotic over 30 minutes.
Okay.
Using a 60 drop per milliliter set. The formula. 50 milliliters times 60 drops per milliliter divided by 30 minutes.
Okay.
3,000 drops divided by 30 minutes, that's 100 drops per minute.
Got it.
Dimensional analysis would be X drops per minute equals 60 drops over 1 milliliter times 50 milliliters over 30 minutes, and you also get 100 drops per minute.
Okay.
Always double check your math.
Right.
And make sure the drip rate makes sense. 100 microdrops per minute, that's pretty fast.
Yeah.
If you're expecting a slow infusion, you know something's up and you got to check your calculations.
Right. That's a good tip. We've covered a lot with those standard dosage calculations. Our sources also talk about some special things to consider for different patients.
Yes.
Let's start with BSA.
Body surface area.
Yes, body surface area. What is that exactly, and why does it matter for medication doses?
So body surface area, it's basically a measurement of the total outer area of a person's body.
Okay.
It's measured in square meters, and it's thought to be a better way to figure out metabolic activity and how the body clears drugs, especially for certain meds.
Okay.
It's more accurate than just using weight alone.
I see.
BSA takes into account both height and weight, and this is super important for some high-risk meds like chemo.
All right.
The goal is to really personalize the dose to each patient.
Right.
To make the drug work its best and minimize those nasty side effects.
Makes sense.
There are a bunch of formulas to calculate BSA. The most stellar formula, that's a popular one.
Okay.
But the good news is, in the real world, there are online calculators and charts
Oh, that's good.
that make it easy to find a patient's BSA.
Okay, so for meds like doxorubicin, that's used for cancer treatment.
Right.
The dose might be given as a certain amount per meter squared of the patient's BSA.
Exactly. It's not just a one-size-fits-all dose based on weight or age.
Yeah.
BSA lets us get really specific, considering the person's overall size and how their body handles the drug.
That makes sense, especially for those meds where you really need to get the dose just right.
Absolutely.
Now, let's talk about kids.
Kids.
We all know they're not just tiny adults.
No, they're not.
Why do kids often need different doses compared to adults?
So kids are still growing.
Right.
Their bodies are works in progress, and how they handle meds, it's totally different from adults.
Okay.
We call this pharmacokinetics.
Okay.
It's all about how the body absorbs, distributes, breaks down, and gets rid of the drug.
Got it.
Their organs, especially the liver and kidneys, which are super important for handling meds.
Yeah.
They're not fully developed yet.
Okay.
Plus, their body composition is different.
Yeah.
Like the ratio of water to fat. So kids often need doses based on their weight or BSAA, so they get the right amount without getting sick from too much.
Makes sense.
And sometimes, because kids metabolize drugs faster, they might actually need a higher dose proportionally compared to an adult.
Wow, that's interesting. So how do we figure out those kid-friendly doses?
Usually, we use their weight in kilograms.
Okay.
So let's say a med says the dose is 0.5 to 1 milligram per kilogram of body weight per dose.
Okay.
If a kid weighs 20 kilograms and the order says 0.75 milligrams per kilogram per dose,
Right.
you do 0.75 times 20.
Okay.
That's a 15 milligram dose.
Got it.
Now, a little baby, maybe they weigh only 5 kilograms.
Okay.
Same dose. You do 0.75 times 5.
Okay.
That's a 3.75 milligram dose.
That's a big difference.
Yeah, really important to pay attention to whether the dose is per dose or a total daily dose. If it's daily and you got to give it multiple times a day, you divide the total by the number of times you give it.
Right.
Giving meds based on weight, that's like rule number 1 when you're dealing with kids.
Makes sense.
Keeps them safe and make sure the meds work properly.
Absolutely. Well, we've covered a lot today. Let's take a minute to sum it all up.
Yeah, let's recap.
Okay, so we talked about all the different systems for measuring meds.
Metric, apothecary, household, avoirdupois.
Right, and how the metric system is the big winner.
Yeah, it's the standard now.
We also talked about why it's still important to know how to convert between them.
Just in case.
We went over the 3 ways to calculate doses: ratio and proportion, desired over have, and dimensional analysis.
What example?
Lots of examples. For pills, injections, IVs.
Right.
We talked about body surface area and how that matters for some meds, especially for kids.
And how kids need special doses based on their weight and sometimes their BSA.
Exactly. Getting this stuff down, it's not just about passing exams.
It's about real life.
It's about keeping your patients safe and giving them the best possible care.
It's the foundation of everything you do as a healthcare professional.
Couldn't have said it better myself. So here's a question for you all to think about.
Okay, I like this.
Meds are getting more and more complex.
Yeah.
Patients have all sorts of different needs.
It's true.
What new and innovative ways can we come up with to prevent medication errors?
Good question.
Beyond just relying on computers and double-checking.
That's something to really think about.
It's a challenge, but we got to keep thinking critically and always look for ways to improve patient safety.
Couldn't agree more.
Well, that's a great question to end on. Thanks for joining us for this deep dive into dosage calculations.
It was fun.
It's so important. And I hope this discussion has made things clearer and, given you more confidence in your understanding.
Yes, absolutely.
All right, until next time.
See ya.
Bye.